I'm Dr. Sunita Lullagur, Senior Eye Specialist at AccuVision Eye Center and I7 Chaudhary Eye Center. It has been long that people wonder why we do see less with aging, of which aging is itself a problem of many disease or maybe degenerative changes which are taking in our body. Of one, cataract is an important thing which happens. Now let's see what is cataract. Now when we see the complete structure of the eye, this is the cornea, then you have a natural lens which is situated over here, and then we have a retina. So whenever the degeneration, normally when we see the lens which is more clear, okay. Now what happens with aging, there is degeneration of the proteins which are there in the lens and it leads to opacification. Like when we look at this figure, this is opacification of the lens which is happening. Now because of this opacification, what happens, the natural clarity of the lens is lost and then we see through this haze which is there. So this reduces or leads to diminution of vision or blurred vision. So this condition is called as cataract. Now cataract can be of many types and depending on the stage your vision will be affected. Sometimes what happens in early cataracts, you will have a little bit blurred of vision, but you can cope up with your daily day-to-day life. There are different type of cataracts, age related. In children also we have seen, which is called as since birth, so called as congenital cataract. Traumatic cataract, it means whenever there is injury to the eye, then it can lead to traumatic cataract. Or sometimes drugs, there are some drugs which can cause cataract, like if you are on long term on steroids or other drugs, then it can lead to cataract formation. So keeping that in mind, you should always have your regular eye checkup once you are after the age of 40-50 years old. In Indian scenario, as we are a tropical country with too much of sunlight and UV radiation, the chances of cataract formation in an Indian scenario is much higher as compared to the counterpart in American scenario which we have seen. Now coming to when should I get the cataract surgery done? Now when we say we have a cataract, one should not panic because it's a normal aging process which is happening, and surgery is the only treatment option available, as there are no drops or any drugs or any oral medication to prevent it. Yes, the role of antioxidants and good health diet is definitely there to prevent early onset of cataract. Okay. Now coming to the treatment or the preventive part. Now how can you prevent cataract? As I told, it's an aging process, nothing can be done, but still get a regular eye checkup, have a healthy diet, include greens, reds and yellow vegetables in your diet. Take lot of you can take some almonds and walnuts include in your diets, and these are all antioxidants which can delay the degenerative process. Now when we say another thing is, as I said, there is no drops, so there is no need to put any drops of that. Sometimes people do take over the counter drops and then say that these are the drops which have been given to reduce the cataract, but that nothing happens. Now, when should one can get the surgery done? Now in cataracts we have seen that the surgery is one of the safest procedure to be done, and nowadays with technology coming, so many good machines are available. The evaluation protocols have improved what we were seeing. So nowadays we are doing laser surgery, micro incision surgery, that is a keyhole surgery. Through a very small incision is made and then cataract is emulsified and removed. Now because as we make a micro hole surgery or a very keyhole surgery, the wound healing is very fast. Now the techniques which are available to remove cataract is, one is laser, where we make a very small laser cut over here where no blade is used, and a small phacoemulsification probe, just like a tip of this pen, if you see, it is entered and whole of this cataract which is there is emulsified. This cataract which is there, it is emulsified and an intraocular lens is implanted, and then the wound healing occurs, and from next day or maybe within 2 or 3 days, like you are back to your normal work. You have to take some precautions which I'll explain you later. So this process is called as laser technique. Then we have another technique which is micro incision, again where a very small keyhole is done around 1.8 to 2 millimeters, through which the probe goes inside, it emulsifies the cataract, and then the cleaning is done and the lens is implanted. Third technique is phacoemulsification, where again the incision size is slightly more than the microphaco, but still it can be removed through a small incision and the wound healing is faster. So because what was happening in initial days, we were making incision from this size to this size, but now the incisions are hardly around 1.5 to 3.5 millimeters, which helps in healing process. It induces no astigmatism, like it does not induce any number. And again the intraocular lens which is implanted, it is implanted as required by your eye power, so that most of the time we help you to get rid of glasses for distance, but for reading you will require some glasses for fine reading. There are different type of intraocular lenses also to be implanted depending on the need of the patient, the profession of the patient. After discussion with the doctor, one can decide about what type of lens you have to go for. Aftercare treatment of cataract, if we look, it's not very hard. Only some precautions are to be taken, like no water should go inside the eye, no rubbing of eyes. These are the two main precautions to be done. Otherwise you can carry forward your daily routine as you were doing before. Regarding what can be done after, like preventive, if we say that there are many patients who come and ask me, doctor, how can we prevent cataract? So I say to them that as I cannot prevent happening cataract in my eyes, how can I suggest? But still, like as I told, good eating habits. Smoking again is one of the factors to cause cataract early. So do not smoke, or if you are smoking then quit smoking or reduce it. Third, again if you are on UV exposure lights too much, like working in sunlight, always wear protective glasses so that UV radiation does not fall directly in your eyes, and then the amount of cataract can be reduced. If you do not take any steroids on your own, always consult a doctor before starting the steroids. So these are the precautionary things which can prevent cataract happening, and once you develop, then you should be seen by an ophthalmologist, get your eyes checked, and then decide with your doctor that when you should get the surgery done. Thank you. For further details, if you want to know, you can contact me. I am Dr. Sunita at AccuVision Eye Center, and you can book your appointments through Librate.com or call through Librate, and also you can visit the website. Thank you.